idea, dialogue. For those who have joined us for the first time, DAREECHA is PPF's open forum, and it is a platform created by PPF researchers to discuss and share views on social issues and problems with young scholars and activists. It invites budding academicians, grassroots activists, researchers, journalists, leaders, etc., interested in understanding through deliberation and dialogue the voices of diversity. We hope and believe that this platform will encourage important and constructive discussions on selected themes and processes between participants and the speakers at local and national level. So the topic for today's discussion is intergenerational cycle and impact of child marriages in India, facets and policies. Every fourth woman surveyed in the age group of 20 to 24 turns out to be married before they turn 18 in India, and a girl under 18 is married somewhere in the world every 2 seconds. Child marriage is a practice that not only infringes on the rights and capabilities of adolescents, mostly young girls, but also has a knock-on effect on other goals such as access to quality healthcare, gender equality, nutrition, etc. Child marriage quite simply robs of the future of these little girls. And while the National Family Health Survey NFHS data reveals slight drop in the overall rate of child marriage from 26% to 23% approximately, not very surprisingly, the problem has only accentuated with the pandemic. The vulnerability to child marriage increases during crisis when family and social structures are disrupted, during natural disasters, conflicts, and be the case of pandemic. While further noticing the developments on the legislative front, it is yet to see if the recent amendment bill in regard to raising legal age of marriage for women, with all its good intentions, will be able to address the multiple dimensions of preventing child marriages and towards girls' empowerment. To throw light and discuss this very pertinent aspect of concern, we have with us Dr. Sukriti Chauhan. Dr. Chauhan is an INLAC scholar, is a trained lawyer with a master's in international development, law and human rights from the Warwick University, UK. She has close to a decade of advocacy and communications expertise in public health and human rights, working with the highest offices in India, including the Honorable President and Prime Minister. She started her career with Path India, working closely on HIV/AIDS, sexual reproductive health, cervical cancer prevention, and maternal and child health. As a director at Global Health Strategies, Dr. Chauhan led the tuberculosis control and prevention project, resulting in national level policy changes and a coalition of members of parliament, as well as set up a $50 million funding pool under the Grand Challenges in Global Health Initiative in India. She has worked with Tata Trust, India Health Fund, Indian Council of Medical Research, and continues to work closely with Dr. Soumya Swaminathan, Chief Scientist, World Health Organization, on mental health in India. Recent has been awarded her PhD title, Legal and Social Impact of HIV/AIDS on Abandoned Housewives in Kolkata and Delhi from Jawaharlal Nehru University. Dr. Chauhan has widely presented and published her work at the global and national level. So in regard to today's discussion, she'll be covering aspects such as causes and incidents of child marriage in India, intergenerational cycle on maternal and fetal health, counting the cost on individual and country level while discussing the laws and cases related to child marriages and the impact of the pandemic. So on behalf of PPF, I welcome Dr. Chauhan once again, and we all look forward to listen to your valuable views on the subject. I'll just take a moment to inform the audience, especially those who've joined us online, to kindly share any question query in the chat box during the session itself to save time. And you can also raise your hand option that's available on the screen, and we'll address your questions as soon as we're done with the presentation. So with that, I would like to hand over the platform to Dr. Chauhan. Thank you.
Thank you so much. Lovely to be here. Policy Perspectives Foundation. I know how difficult it is to start off on your own to work on difficult issues, but I can assure you, you have my support in whatever way you need. But before I start, on the call is my team. There's Ashita and Shireen, and I just want to thank them because I think, when we get too busy, it's our teams who support us to really be able to do this. I am honored to be here. You've already introduced me. Thank you so much. Feeling a little embarrassed about the detail of it, but lovely to be here and talking to everybody. Hope I can get to answer some questions. I want this to be a little bit more of a conversation because I don't believe in lectures, especially on such sensitive issues. But we have prepared some slides for everybody's benefit, and I'll quickly present them, and then we can get on to the discussion. Is that okay for you?
Sure.
Okay. So when you talk about the intergenerational cycle, what it basically means is, even before we get into the slides, can I use both English and Hindi? Is everybody comfortable?
Yeah, it will be good if you'll be bilingual.
ठीक है. So intergeneration cycle जब हम बात करते हैं उसका मतलब ये है that women get married very young, 14-15 साल में, 13 साल में, 12 साल में, and the reality is that it's happening. COVID has actually pronounced it even more. But young women, when they get married, like, I'm a girl when I was 12, and if I was pregnant, what would that mean for my body? And I think we have to start looking at it from that perspective. But young girls are getting pregnant, they are producing children, and because they are weak themselves, because they are kids themselves, honestly, their children are also weak. And that's the intergenerational cycle, that you make a young mother pregnant, she produces the child is stunted or is wasted. जो 2 टर्म्स हैं जिसको हम न्यूट्रिशन की वर्ल्ड में यूज करते हैं, या उनकी हाइट ठीक से नहीं बढ़ती या वेट ठीक से नहीं बढ़ता, एंड दैट्स बिकॉज द मदर डजंट ईट. एक बहुत फेवरेट सेइंग है इंडिया की, व्हिच इज women eat last, and they have been eating last, they seek healthcare last. I think we together need to change that. And with that, I will request my team to change the first slide. So this is a poll question because I wanted to make it a little bit more interesting. Ashita, can you come in? Unmute yourself, please.
Yeah.
How are we going to do the question?
So Monica said that the PPF doesn't usually have polls, so we can just, everybody can maybe type in their answers to what they think is the most likely option.
Would you like to guide them on this one?
Okay.
Go ahead.
So we quickly would request everybody to answer this poll question to how you think is, what do you think is the impact of child marriage on the individual? We have 5 options before us. First is enhanced gender-based intimate partner psychological abuse and violence. Second, denies right to choose whether, when, and whom to marry. Third, higher exposure to STDs, including HIV. Fourth, poor health, including mental health. And fifth, deprivation of childhood and future. So before you are 5 options, whichever you think is the most gravest impact, or whatever you think is the most relevant, you can just quickly type that.
I request everybody on the call to be a participant in it. I love that all 5, Shruti. I agree with it. I think it's all interlinked. But Shireen said 1. Shireen, would you like to come in and tell us why? Shireen? Hello? 1 and 4. We've got 5 here, deprivation of, okay. Ashita, can you hear me?
Yes.
Can I have Shireen explain why it's 1 for her? I think it's nice to get a perspective.
Am I audible?
Yes, you are. Just speak up a little bit.
Yes. I think I chose 1 because
No, can't hear you. Can't hear you.
1 sec. Am I audible now?
Yes, go ahead, please.
Okay. With child marriage, especially, I think because the person is not an adult at that time, their ability to really choose anything for themselves in that marriage is very low. That can lead to a higher burden of violence on them because people do not consider their opinions or their choices as valid. And in that case, the cycle of violence is something that can rise further.
Okay. I want to actually, before I proceed, maybe hear from the Policy Perspectives Foundation. Is this an issue you work on, and who's the audience, so that I can appropriately message what I'm going to speak?
So we do work on child rights per se, not just child marriages. We have worked on FOXO. We have conducted.
In the sense of changing the law or implementing it?
Checking the implementation policy.
Okay, all right, okay. So
we-
that's research.
Right, right.
Okay, okay, thank you. Thanks, Nandita. Thanks. Which part of child rights have you? And only reason I'm asking you this is because it's such a complicated and fluid world, right?
Yeah.
We can start talking about it. But okay, let's try. Let's get through the slides, and I'd love to literally like have a conversation. And if you can, then maybe if you feel correct, you could open the platform so that people can talk to me directly. You know, there's an option for that. And I think I would love to do that instead of just like a one way, you know, me answering a question, but I'll leave that decision to you.
You can take your time to present, and probably then we can open the table for discussion.
Let's do that. Let's do that. Next slide, please, Ashita. So we've got about, you know, we had a discussion about you polling on the 5 main reasons. But I think just child marriage by itself is actually rooted in patriarchy. Before I get into, you know, the 6 reasons for it, it's a very societally limited thinking of the way to do things, because, you know, girls are born and girls have a tough time from the time they're in the fetus to the time they die. And actually, you know, I'm going to be very open, and it's going to trigger a lot of you on the call. But I think it's good to be honest and not just go through slides. But from the time you conceive a baby and it's a girl child, and of course, sex determination laws are there, we all very much know, you know, what happens when you conceive a girl. And if you're from a family that doesn't want a girl, what happens to them? It's not a surprise that, you know, young girls are being killed in the womb. And I say killed because it is killing. Like it's a fetus that doesn't have an option. Now, when girls grow up, they're going to be 12, 13, 14, and we feel like, you know, it's a burden to raise them because you've got dowry, you've got these gender norms, which are completely skewed. And I don't need to talk about that to you. I think on the call are people who are very sensitive, who understand it. And I'm the last person to reiterate that to you. But on this slide, you can see the causes. And number 1, always in any situation of vulnerability is poverty. You know, when you are poor, your options are very, very limited. Now you're poor and you have girl children. In COVID, literally people got their daughters married with less dowry. And there are cases which have been reported to us that, you know, feeding them was a problem. And, you know, it was important to feed the boys, but girls came, you know, last. And I think that's where I always say that women eat last. Children who are girl children eat last. So that's number 1. Limited education and economic opportunities, because, you know, if you're not going to send them to schools, then there's going to be an issue. And in fact, I've been very lucky and honored to have worked with Children Investment Fund Foundation and Tata Trust. Children Investment Fund Foundation, also called SIF, is based out of London, and they actually run a program called, you know, Keeping Girls in School, and how important it is that education is completed, because, you know, there are graphs after graphs to make you understand that if you can really educate a girl, take her through schooling, provide an opportunity through college, it's going to change the dynamic of the way she lives and you live incredibly. But unfortunately, that's not happened. And it is a lacune that we need to fill. The third is safety. We always wonder how to keep our girls safe, especially during conflict. All of you who have worked on conflict issues, climate change, will know that women are used as weapons. And I'm going to be very open here and tell you that in Ukraine, that's what's starting to happen now. Because where there is depravity, it's going to lead to women being used as tools of war. I'm actually going to be very happy to share one of the pieces I did when I was at Warwick and it was published. It's basically armed conflict and women at the center of it. Like how you use a woman's body to really establish a point. And I think this is something that we need to understand and work towards. The fourth is social and religious norms. When I was doing the talk and I was talking, I was discussing it with my team, religion is really, like, I absolutely respect everybody's choices. But you have religions where women are supposed to be goddesses, and then they are at the bottom rung of society. So I think that dichotomy has to be fixed, but religious and social norms really have become, जिनको कहते हैं पाँव की बेड़ियाँ, literally, औरतें उठ नहीं पाती, कहीं जा नहीं पाती, whether it's menstruation, whether it's pregnancy. I don't know how many of you even know, but postpartum is a very serious issue that occurs in the world and nobody's talking about it. And I saw that you spoke about mental health, etc. But we don't have enough going on. And I don't think women need to be at the center of conversations, and they're not. Example, in political power, slightly diverting, अगर आप औरतों के लिए लॉ बदलना चाहते हो, पॉलिसी बदलना चाहते हो, तो औरतों को पार्लियामेंट में होना जरूरी है. We've had a 33% request now for about 18 years. It has not been fulfilled. And I'm sorry, but not a gender bias. I think men equally have to be part of this conversation. Transgenders have to be part of this conversation. Communities have to be, but please, women have it very, very difficult. The fifth one on your screen is lack of registration of marriages. I mean, I don't need to explain that. I think the law is complicated. Also with the POXO debate, with the other debate of child marriage and how we want to proceed is an issue which Policy Perspectives Foundation should explore, because it gets very murky and complicated when it comes to the law. Sixth, and I'll close out with that, is patriarchy. I started with that. I think the real problem and the real issue, insect, I don't know what you want to call it, but I think जब तक patriarchy होगी, और मुझे लगता है 2 generation और लगेंगी, at least, to deal with it. But let's play our part. Ashita? I'm not going to read this. I think all of us know the data, but seriously, like every 4th woman aged 20 to 24 is married under 18. All of us know that there is an act in place to raise this to 21. There is not enough information about why that might be negative, why it may be positive, but I think that's an area we really need to explore and we need to respond to. If you're pregnant, by the time you're 15 years old or 16 years old, you're going to give birth to children who are undernourished. And ultimately it's going to be a cost to the country because they are not going to grow up to be healthy, neither are the mothers. So I think that is the intergeneration cycle Ashita, me, Shireen, along with the Policy Perspectives Foundation, want to just talk to you about. Next. Ashita, may I ask you to come in? I think this slide can be explained by you. Go ahead.
Okay, so here we're discussing a very recent UNICEF report from 2019 that is talking about what exactly the data of child marriages in India is. So again, like you just said, 1/3 of the global total of child marriages was as recorded by them in India. As you mentioned, poverty is a factor. So most of these girls that they encountered were from poorer households or had no or little education. And lastly, how child brides do go on to have larger families because there is again limited education. There is there is intercourse happening, so that does lead to adolescent pregnancies, and they tend to have larger families as compared to women who marry later on. And here we just have a graph that is showing what, if you can see my arrow, which proportion of like women gave birth at or after the age of 18, but before the age of 20.
So just adding to that, thanks Ashita, and why I brought you in is because I think you've read about it, you worked on it, and I think your perspective is very important for me. And that's why, I requested you. But please, everybody who's on the screen right now, read that number. 223 million child brides, out of whom 102 million were married before turning 50. I think by itself, even that data it's crazy. Like if you imagine it, diseases kill people, diseases affect people. This is not a disease. This is a curated thought process which we need to change, which is, accompanied by patriarchy, accompanied by bullying, accompanied by the fact that women should not have a right to say what they want to say when they want to say. I mean, 15 years old, and now you are on the screen with me. Please remember the time when you were 15. Would you like to be married at 15? I wouldn't, certainly. Because first of all, it's not a decision I've taken. It's a decision somebody else took for me. I'm pregnant by the time I'm 16, and I'm producing a child that's undernourished, and I'm undernourished myself because I'm not a priority. And that has happened. And COVID has honestly really, really worsened the situation. This isn't the latest data, but if you were to go and find out how families responded to this issue, I think you'll be even more shocked. Ashita, next slide. So UP, for the fact that it's one of the biggest states in the country, has 36 million child brides. You will see Bihar, West Bengal, Maharashtra, Madhya Pradesh. So it's not like, it's like a cycle which runs through only North India or whatever. I think every state has its unique characteristics. In fact, further in the slide set, we are going to talk to you about some of the work I've done on a very complicated issue of teenage pregnancy, which I did in UP. And just wanted to share that example with you to show how serious the problem actually is. हम जब बैठते हैं और हम कहते हैं चाइल्ड मैरिज इज एन इशू, इंडिया में चाइल्ड मैरिज है, ये है, वो है. Just look at the numbers on your screen. If you add that up, just between UP and Bihar, that's the number of girls who are getting married below 15. So I think we definitely have a serious problem, and we keep going back and forth on it. And, we keep talking about child rights, but I think it's time that we really come together to really address it at the grassroots. And the only way you're going to battle this is education, behavior change. It's not going to happen on a call that I have with you. I think हमें ज़मीन पे जाने की ज़रूरत है, and that's what we did on the project that I'll just talk to you about. Arsa, you'll want to come in here, or Shireen, just help me with this one, and I'll take the next one on.
Coming again to the idea of the intergenerational cycle and how child marriage is linked to poor health and nutrition, while researching the few effects of what can happen with child marriage, one of them is the most complicated issue of marital rape, which people don't want to accept, don't want to believe exists as a practice widely that happens in India, and early pregnancy. And like Sukriti already mentioned, with early pregnancies, there are challenges with nutrition, which is the second point where you talk about undernutrition and malnourishment of the mother, but also the child. Because if the mother does not get the adequate food, even in India, there has always been a practice where only during pregnancy is the health of the woman considered as important. But whatever medical experts mention, they say that your information and your studies 1,000 days before and after pregnancy is very important for the mother. And we do not care for it yet. The complications can also happen during pregnancy. Like mentioned, people can have miscarriages, stillbirths, deaths, which can again, all of these have their own counter effects, like mental health effects, economic costs, which need to be talked about and need to be understood in a much better manner. And like already mentioned, it can lead to stunting, wasting, people not developing the required emotional or behavioral capabilities because their mothers never got the chance to develop them. So most of these young generation, we lose out on developing healthy adults for the society.
Thanks, Shireen. Can we go to the next one? So when we say cost of inaction, just for everybody on the call, it's one of the favorite words in economics. But the point is that if you don't step in now, what does this actually mean for the next 20 years for your women and young girls? You can easily see it leads to an increased economic burden for the child and their family. I mean, you've got young girls who are pregnant. They don't have the ability to work, to protect. You are hardly feeding them, taking care of them. But if you are able to address it, what does it give you? It gives you gender equality. It gives you probably an opportunity to respond to one of the biggest issues India has, which is infant mortality and maternal health, both of which are so important to the policy perspectives, foundation, and the work. And I think ultimately it leads to, who is contributing to the growth for the country. We are 50% of the population. And when I say we are the women who are 50% of the population, which includes young girls. There is no justification for why a 12, 13, 14, 15-year-old girl should be getting married. But I also think it's not a solution that you can find just by having conversations. So my suggestion would be that it's a subject that's actually of deep interest because it impacts maternal health, child health, it impacts so many spheres, right? I do think that there is a lot of people out there who want to support this research, and it should become a subject of great concern. You do have a law in place, but it took you 15 years to do that. How are you going to implement that law becomes important. But the reality is that girls are getting married under 15. Next slide, Ashita. I'd like the team to come in here because I want to present with them. Ashita, come. Would you like to talk about this?
Okay. So, like Dr. Chauhan just mentioned, with the pandemic, with the disruption caused to education, with the economic burden, increased hardship on families, they are seeing families in India particularly are seeing marriage as a way to, for now, as probably a solution, or, just seeing that because girls are at the house, just a possible increase can be witnessed and is predicted. So before us is a global estimate. UNICEF in a 2021 report has estimated that over 10 million more girls are at a risk of becoming child brides by 2030, which is a huge, huge number. And in India, Childline, the helpline for that that records abuses or distress calls from children or about children, noted that there was a 17% increase in only the 2 months of June and July in 2020, which is huge.
Thank you. Should we go to the next slide? So I didn't want to go in detail on all the laws and the bills because I know they're publicly available. But why I put this slide up is that please see, it's not like India is not thinking about it. We are. But simply having laws and legislations and like policies doesn't work. One has to work with the system, with the grassroots, with the people to be able to make that change. On your left, you can see prohibition of child marriage at 2006. We are in 2022. And I can tell you right now, child marriages are at the highest rate because of COVID, because of desperation, because midday meal shut down, because kids could not go to school, multifarious reasons. But it doesn't matter how many laws you put into place or how many precedents are there, but I would encourage all of you to read this. On the right side is the amendment bill that I was talking about. It has multiple pros and cons, and honestly will take another long conversation for me to explain why it may not be the best thing currently. But do read about it because it equips you. It equips you to do your work better. जब आपको पता होगा कि आपके पास क्या available है in terms of law, policy, तभी आप change ला पाएंगे. Can I see the next slide? So this is to PPF. This is the organization, and थोड़ा सा इसके बारे में मैं बात करना चाहूँगी. COVID, of course, has been horrible for a lot of us. We've lost family, we've lost friends. But for me, it was also, apart from being a very negative time, also a very inspirational time where जहाँ पे मैं बहुत सालों से अपनी organization खोलना चाह रही थी, खोल नहीं पा रही थी. And on your screen, you can see Eti and the colors of the trees, the leaves that you can see that's coming out of the bubble. It signifies struggle. जिसको कहते हैं मुश्किल. It can be the color of menstruation, it can be the color of pregnancy, it can be the color of abortion, it can be like gender is central to our work. And that's how we started Eti. I think we started Eti together, and it's only befitting if I can have my team talk about it. Shireen, would you like to come in?
Sure. So ETI stands for Empower, Transform, Inspire, and the organization works on, creating safe and equitable access to health and security, especially keeping the most vulnerable and marginalized at the center of it. Because while we as adults, we have the access to a lot of opportunities, but there are multiple populations and groups who do not get access to basic services just by the virtue of being maybe being from a lower class community or being from a different gender. So how we work is that we work with experts, not only taking the technical and scientific guidance, because that's what's required for you to have evidence and hard data to prove to the world, but also ensuring that community voices and those at the grassroots can come up and share their experiences for there to be real life experiences which can counter any sort of stigma that people can have about a certain issue, and a really holistic approach towards addressing it.
Next slide. तो हम किन चीज़ों पे फोकस करते हैं? हम फोकस करते हैं because my career has been in communicable diseases. तो tuberculosis जो Prime Minister का भी number one priority है. How did it become a number one priority? हम हमेशा सोचते थे TB सिर्फ गरीब लोगों को होता है. But TB अमीरों को भी होता है, बीच के middle section को भी होता है, and it's a huge issue. India has the highest number of people dying from it. But how do you bring the attention on that issue? And I don't think child marriage has had that attention. I think there has been a lot of research. I just don't think it's been at the level of what it deserves. So ETI is going to obviously work on that. Like I told you, gender is central to our work. The second pillar you can see is financial security and inclusion of women. And that is central to the fact of addressing an issue of child marriage. जब औरतें independent होंगी, तो ये decisions उनके लिए कोई नहीं ले सकता. But ये बहुत rare है, but it is something that should be a goal. Like I said in the beginning, we are 50% of the population. Can't really ignore us for so long. The third is adolescent health, and Shireen will be sharing an example of our work with that. But most importantly, creating safe spaces. मैं किसी से बात कर रही थी about a week ago, and it was an adolescent health issue. And on the panel were 8 men, one woman, and no adolescent. So I told them, I said, you have no idea what young kids want today, and you are deciding for them. So I think let's just stop deciding. Let them come to us and learn. And on this forum, I actually want to say, मैं apologize करती हूँ to all the young people कि हम उनकी बात ही नहीं सुनते. हम अपने आप को इतना empowered feel करते हैं that we can decide for them. We can't. And I'm sorry that they've gone through this time. I have gone through that time personally. मुझे ये नहीं समझ आता, like how do you decide for an adolescent what they want, what they need? उन्हें शादी करनी है, नहीं करनी है. They need sex education. They need to stay in schools. You can't decide for them. And I feel very, very strongly about this subject, and that's why I wanted to share that. Mental health, obviously, I think it should have become an issue, I don't know, 25 years ago, but वो हुआ नहीं. Fortunately, COVID has given us the opportunity, and ETI is actually very, very focused on working on mental health, especially with young children. Children, adolescents, we want to listen to them, we want to create safe spaces. So that's another thing, PPF, that we are doing, and we hope you can engage with us on that. Research, because Shireen has already said, there's nothing without evidence. You need to have your data correct. You need to understand how deep an issue is before you can intervene. Shireen, would you like to take the next few slides?
Sure. So the first is the work that was done, like Sukriti said, in Uttar Pradesh, which was on teenage pregnancy. And this employed working with the parliamentarians, the top officials of the government, but also working with the communities to ensure that their perspectives are taken, their difference in challenges are understood. And there were primary healthcare centers and healthcare centers, but these were not accessible to the youth population. The adolescents did not find them friendly or to be able to discuss their challenges. So the work involved really rebranding which became Sathya Kendras, where people who are young can go and express their difficulties, be it about teenage pregnancy, be it about sexual or reproductive health care, whatever they require, and get the required care support on their end. It reached about 1.5 million additional adolescents and was taken up in other states in India as well. The next one is the Ab Meri Bari campaign, which happened across 3 states, which is Jharkhand, UP, and Rajasthan. All 3 states which involved around more than 300 girl champions who had recently become voters. And it was to really hear from them what were the difficulties that they faced with reproductive health, reproductive rights, or sexual rights, and what is it that they want their government to do. So they developed a charter of demands, and they had a 15-day bus tour throughout these 3 cities, where the girls interacted with the government officials to really bring out and share their experiences so the required policy changes can happen at the top. Coming to the last slide, this is about Breaking the Barriers white paper series. We worked with another organization called PATH, where our authors were from ETI. We had Dr. Virendra Singh Chauhan, who's the founder of ETI. There was Dr. Madhura Swaminathan, Dr. Vikram Patel, Hindal Sen Gupta, all of whom contributed to different perspectives, be it economics, gender, digital experiences of how the COVID-19 pandemic really impacted India. What is the cost of its inaction, and what do we need to do to really take care of mental health challenges that happen in the country? The paper is available to read on our website, and we can drop in a link here as well for your ease.
Thank you so much, Shireen. Anything else on the slides?
No, that's all from our end. Maybe we can open the floor for discussion now.
Okay, let's do that. Over to you, PPF.
Thank you so much, Dr. Chauhan, for a very enlightening presentation. And it actually tells us, and I would like to reiterate, that strong partnerships at all levels are required to end this child marriage concept. So at present, we don't have any questions in the question answer box. I would request the participants who joined us online and those who are physically present with us, if there are any questions, please put up in the question answer box. Meanwhile, I would like to start the conversation with you and ask some questions. So you have talked about several projects where you worked, the campaigns you've conducted in UP and states like Rajasthan and Jharkhand. They're actually very interesting to know about. So I wanted to know, did you face any ground level challenges while you were doing it? And so that's my first question. I'll probably come to another one after you answer this.
Okay, I think that's a great question, and I do hope that everybody who's logged in is going to also ask some questions. But to answer you, I think the biggest challenge was the gender stigma that I faced. You know, being a woman when I was on ground and I was leading a team which had probably 70 to 30% female versus males, I think the patriarchy is so deep seated that the biggest challenge I faced was they asked me that what's the problem? And they were like, aap to Thakur hai, so you should understand this. And it all comes down to caste politics and religious politics. And it's ridiculous. But I think aapko kya karne ki zarurat hai? You should be equipped with the information. आपके पास इतनी preparation होनी चाहिए and you should be prepared to face the patriarchy. I'll be stupid if I tell you कि वो नहीं होगा. Of course होगा. आप grassroots पे जाइए, आप highest levels में जाइए. It's going to be an issue, but be prepared with data.
And also, while you were working with these girls, the project, the campaign you talked about for Rajasthan.
अब मेरी बारी. Yes.
Yeah. So in that, while you were working with these girls, तो उनकी side से भी, did you notice that there were some challenges or probably any sort of case studies you would want to share which you think are very important for us to know?
I think more than case studies, I think they are my heroes.
Yeah, definitely.
And not all heroes wear capes. And मैं बहुत proudly कहती हूँ. And 350 is not a small number to get onto buses.
Actually, a very.
I think they faced issues at home, but it's because of our interventions, our conversations with their parents. So मैं हमेशा कहती हूँ, when you want to work with adolescents, you need to work with their parents. You can't preach to a girl to fight the system. You have to speak to the parents, you have to speak to the brother, take men along. And I keep saying this, and it's completely ignored, but the 350 girls who were with me, we had taken their parents along, we had educated them. We've always said that the battle cannot be won on just the women fighting. It has to be men coming along with us, right?
Persuade them? Was it difficult to persuade them or?
It was difficult.
Definitely.
From a personal experience, being as empowered I am,
Right.
it's difficult. I face it, like I'm saying it openly on this call. I face a lot of patriarchy. Like I said, I'm a Thakur from the northern belt. You can only imagine how much of a eyesore I must be to people. But would I do anything otherwise? No. So I do think that women need that empowerment, but while you're empowering them, don't leave the men behind. Because the minute you'll do that, it's not a women versus men, girl versus boy. It's about changing the way we think as people. And men are very much and very important to the conversation.
Especially at times when this definition of feminism is taking a very sort of U-turn nowadays. So that's another subject we'll not delve into.
नहीं, but let me please come in and say, feminism को आप जैसे define करना चाहते हो वैसे नहीं कर सकते ना. I am a feminist, you're a feminist,
right?
But we are not evil because we are feminists or we believe in gender equity.
Yeah.
But feminism का definition इसलिए change हुआ है because it took so many different directions, you know, bra burning, anti-men. I'm not anti-men. I think no project can work without taking men along.
That's very
like I would be the last person to say support women and hate men. That's not the way the system works. So, but I am a feminist and I'm saying it very, very clearly on this call.
So with this, we have some questions in the question.
Go ahead.
I'll read it out for you. So there's one question by Nandita. She says that how the new act, which raises the marriage age of to 21 for all individuals, will affect this vicious cycle of child marriage and teenage mothers. And that also brings me to the fact that you said that you have some observations about it. So I'll request you to throw some light on that.
So since it's still under, legal consideration, my problem with the act is that आपने age तो बढ़ा दी, लेकिन आप 18 भी था तो भी आप maintain नहीं कर पा रहे थे. And I'll tell you why it's an issue. For women, it's an issue because the government of India has proposed that we'll raise it from 18 to 21 without consultation with anybody who's been on the ground, and I'll be very open about it. And I just think, it's going to come up in December for a formal hearing again. And the issue is that it basically overrides a lot of religious laws in the country. We've had religious laws for every religion. It's not only Muslims or Sikhs, or there has been a law for every, I don't know, every religion, every group that believes in a certain sort of functioning. And I don't think this is such an easy debate. You want to have a united law for the country, you can't do that. You can't override people. It has to be something that you take people along with. And I think my problem is that it overrid that. You already have a law that anybody under 15 should not be married. Shireen started the conversation with marital rape.
Yeah.
And it not even being an issue.
Right.
In fact, marital rape is something I have been standing behind, and I'm like, okay, let's fight for it. Let's just make it legal. How can we be one of the countries next to, say, I don't know, like the countries that believe in nothing when it comes to equality? And we are standing with them, North Korea, and we are saying that women should be raped in marriage. And I'm very open about it and I fight about it. And I'm like, just because she married you, you don't have a right to force sex on her. And if she wants to take a recourse about that, then she should be allowed to. But that's another conversation day that we can definitely have. But to just respond very quickly to the question that has been raised, I think the bill was done in haste. I think the bill was not thought through. I think there are different communities of people, and India's beauty is that it has had that. And I think we needed to respect that, which we did not.
In fact, you're very right that it cannot alone solve the problem. So even if we go back to the task force committee report,
Yes.
it had a lot of recommendations. And one of the recommendations was raising the legal age for women. While other recommendations have been completely kept aside, this was the only sort of recommendation that was adopted and the bill was introduced. So that is something, and not many people, because even in the articles that I was reading, it doesn't mention about any other recommendation that was there in the report. So definitely that is a matter of concern where we're just bringing out incomplete information in the because the committee itself sort of defended saying that there is a couple of other recommendations that they wanted to bring in, and they wanted the law to sort of supplement that, but that did not come into picture. So
agreed. And I just feel like, I mean, I know you're recording this, but I have no problem saying it.
You shouldn't worry about that.
I am not at all worried, believe me. I'm in this conversation with you. I think I've been very open. It's very clear that the government will move against a certain community. And I think you should remember that. Why should a girl turn 21 to get married? Just think about it. Read the personal laws of the country. Look at where they stand. And what is the reason that they have done it? That it's directly linked to population control. It's directly linked to, growth of communities. And I don't remember India being a democracy. And my politics must be clear by now to everybody who's on the screen, which way I stand. But yes, I respect the mandate of the people, the government that's in power. I can't do anything else. We will get the government we select to. But I think going after something as personal as deciding marriage is a very big issue. And that's why it's still an act. Before it's a bill. Before it becomes an act, there's going to be a lot of debate on it. And believe me, I'm going to front head that.
Thank you so much. So I would like the audience who are present with us physically here. Do you have any questions? Okay, so we have 2 questions in the question answer box.
Yeah, I saw that.
Okay. So I'll read it out for you. How tough is it to talk with those families who have made their children get married under the age of 18? Like, from the family side perspective, do they also face some challenges probably which we can address, the country should address?
Sure. I think 90% of fathers and mothers love their children, right? 10% don't. But I think the problem is that there's poverty. That's the first thing I brought up on the slide. And thank you for the question and allowing me to reiterate that. When you're poor and you're hungry, nothing else really matters. And when you have 10 mouths to feed, which is why we have the second highest population in the world, बिकॉज जब हम बच्चे करते हैं हम सोचते हैं कि ये बच्चे हमारे हाथ बनेंगे, पाँव बनेंगे, बट बच्चों को खिलाएगा कौन? और सबसे आसान क्या है? लड़की की शादी कराना, टू गिव हर अवे. Girls are considered a burden. There is no doubt in that. I can tell you, as empowered as I am, I feel like a burden when I travel to my home state. If I can feel like that, imagine what a family feels like with no economic independence. So the reasons are that they are poor. Do they regret their decisions? If I tell you that I have done 10 cases, 8 have. They really have. But they say that हमारे पास ऑप्शन नहीं था, बिकॉज ऑप्शन क्यों नहीं है? क्योंकि हमने उनको ऑप्शन नहीं बनाया ना. हम डेवलपमेंट सेक्टर में काम करते हैं, दे नीड अस टू सपोर्ट देम, और हमने नहीं किया. यू कांट एक्सपेक्ट कि एक आदमी है जो गरीब है, जिसके पास खाने के पैसे नहीं है, तो जब तक आप ऑप्शन नहीं देंगी जाके तो उनको कहाँ से मिलेगा? तो उन्होंने वो ऑप्शन यूज किया. बट इट इज रैम्पेंट. And it is happening. And like I said, if you read the COVID data, you will be astounded. I want my team to come in here. Ashita, you want to add anything? Because I know that you and Shireen feel about this, and I would rather not have this as a lecture, but a conversation. Go ahead.
Okay, Shireen, you start. Okay, so yeah, so a couple of things, as you very rightly said. Girls are seen as a burden. There is no denying that. Why, like, child marriages increase in the pandemic is evident of that, because people had so many responsibilities on them, and they thought, okay, at least we'll get this one sorted. That is a mindset that will, I think, we're a long way from changing. But at the same time, us not, the conversation about marital rape, for one, we have to understand that, you have to call, what's the expression? You have to call a spade a spade. You have to say, in everyday conversations, you have to, even if it's a solemnized marriage, child marriages are solemnized. That doesn't mean it's legal. Right. Sorry, not legal. It doesn't mean that it's right. It doesn't mean that what is happening there is not marital rape. The conversations around the subject have to change, and that'll take a long time. And what? And Shireen?
Can't hear you, Shireen. Would you like to just speak up?
Am I audible now?
Yes, you are. Go ahead.
Yeah. So, of course, the conversation starts with changing the attitude and understanding all of this. But I think at the core of it is always going to be us understanding the differences in gender. Basically, the thing that sex and gender are two different things, which a lot of people in most of the world don't know or are ready to accept. I think that forms the basis of how we really look at gender. What we mean when we say gender would really help us in determining how we can work against basic issues like child marriage, access to services.
I'll stop here, and thanks, team. Over to you.
So the next question that we have is, how do you assess the various schemes and programs that government is taking up to address the various challenges posed by child marriage? Especially
the latest one that they've done, I shared that screen with you. There was a scheme in 2006. That's the law against child marriage. Have there been any other schemes? No. Just raising the age to 21 is not you addressing child marriage. It's you trying to find a pathway to really impact some other things. And I've already mentioned that to you. How do I assess them? I think by terms of policy and law, they look solid. But I would really like to see them being implemented. बहुत सारे cases in child marriage में जिसमें मैं personally, I have gone to stop the marriage, and the DM of the district is sitting right there when the marriage is happening. So if you're going to be hand in glove with the police, if you're going to be hand in glove with the politician, then it doesn't matter how many laws you really have. But do we have laws? Yes. Are they implemented? No. Why are they not implemented? Because machineries are hand in glove with this sequence.
Thank you, Dr. Chauhan. We have another question with us, so I'll.
Okay.
Hi.
Good morning, ma'am. I have a few
Hey,
questions.
good morning, good evening, sir.
Oh, sorry. Good evening. What is my question is focus on two things.
Hanji.
What is your views on practices of child marriage in
Mhm.
rural areas still persist? This you have
Okay.
already mentioned.
Yeah, she's already answered.
But I believe some local people in rural areas still believe that early marriages may bring more enabling or to earning capacities of the children and uplift their livelihoods in the long run.
What is your name, sir?
My name is Akoizan.
Hi, nice to meet you.
Hi.
Thank you for the question. I think pehla wala question I've answered, but the second part of it, people believe what they want to believe to make their actions explainable. हमने कुछ किया और हम उसमें believe करते हैं इसमें अच्छाई है. तुम खुद सोचो, just for 2 minutes, and this is for the audience, how is it helpful if you marry a 12-year-old girl who gets impregnated by 13 for your economic independence? It's nothing. You don't want to feed her because you can't feed her. You're poor. She's the one who's going to eat last. And that's exactly the cycle of child marriage that is followed. Okay. It's a ritual. I'm from Rajasthan. I have seen at least 150 child marriages where girls are 12 years, 10 years, 13 years. That's not an age to get married. For economic independence, kya hota hai? You are not even developed in your brain. Your bodies are developing, for God's sake. You get impregnated by the time you're 14. So there's no justification. If they believe that, number one, they are wrong. Number two, it is up to people like you and me to try and work with them to empower them, not to lecture them, but work with them to change the system. I hope that answers your question.
Yes. But still, they still practicing the system that follows.
Yeah, definitely. Marital rape की बात करोगे तो Constitution of India says we will not get into your bedrooms. Why will you not get into our bedrooms? Why? If I don't want to have sex with my husband, he doesn't have a legal right to do it. And that's one of the issues I'm actually working on. So sorry, I feel very strongly about it.
Another point is how the government ensure child marriage, ensure ending of child marriage by raising the marriage age up to 21.
That has nothing to do with child marriage. Like I mentioned earlier, raising the age to 21 has a very different reasoning. Very, very different reasoning. It's going after a certain, you know that there's not a uniform civil code in the country, right? And that's one of the demands from the current government. It's got nothing to do with child marriage. You've had a marriage age of 18. Have you followed it? No. So let's just not first of all get confused about this new law and child marriage. You can make law after law, but till you speak to societies and you work at the ground, nothing is going to change. Law kaun banata hai? Lok Sabha, Rajya Sabha, Constitution. You think people really know what's happening? When I told you that police is involved in those marriages, they're eating the sweets at those marriages, knowing that it's illegal. You are talking about a system which is interbred with them. So the only way to change it is education and taking people along and really champion voices. And we've seen that happen. अब मेरी बारी जो मैंने आपके साथ campaign share किया वो इसीलिए था. Because none of the girls were able to speak about reproductive health, sanitation. So suddenly they came together and the government had to listen. But उसमें time लगता है. It took me 3 years to do it. And I did it at a very small scale.
Okay, thank you. Thanks so much.
Thanks.
Thank you, Dr. Chauhan. I think we are done with the questions.
Okay.
But I would really like to thank you. It was actually a very enlightening session, and especially to know about the campaigns that you've conducted on ground and the challenges and the suggestions you have in view of those experiences that actually added value to the entire. So we definitely look forward to a continued association with you, and we'll definitely get back talking on these subjects and working towards the right cause. So Okay, there is another question. So,
Go ahead, please. Go ahead.
they're probably just handing it over. Okay, so we have it in the question answer box now. So I read it out. In certain segments of our society, traditions do help perpetuate practices that nurture practices of child marriage. How do we battle this? So this is a very interesting question.
Very interesting and a tough one, and it's going to be a tough answer to listen to. Who asked it?
So it's President PPF who has asked. So yeah.
Awesome. So it's going to be a difficult one to listen to. Traditions are your real barriers. जिनको कहते हैं ना बेड़ियां जो तुम्हारे पाँव में लगती हैं, like as women when you're growing up, from the time you are in the stomach to the time you get married and beyond. You know, I'll share something with you. It's so difficult to be a woman if you really think about it. You know, you are the one who's going to have the period, you're the one who's going to have the baby, you're the one who's going to go through menopause. In between, you must get married. You also should respect the family's respect, and I completely get it, completely understand it. But I think the only way to change it is education, and I truly believe in it because I have seen it change. Whether it's one district, two districts, three, if I can speak to the Rajputs of Bikaner and change their thinking that औरतों को पर्दे में शायद नहीं होना चाहिए. You know, why should you cover their faces? They should be able to access healthcare. They should be able to get eye checks. If we can do that, but it takes time. It takes time and it takes effort and it takes working with community. Don't dictate to them. Go to the community, learn from them, and let the community drive the change. So one of the examples, which I'm going to just take a second, Shireen, you want to come in with the nutrition example? I think it's very interesting.
Sure. Okay. For the nutrition example, that's the work that was done in Odisha. It was called the Angul Pushti Adhikar Abhiyan, which really involved working with the people using a participatory approach, because while there were schemes that have been made available by the government, and the government allows you to, you know, access nutritional facilities at different clinics, but do these schemes really reach the people? The answer was that they don't. A lot of people don't know about the schemes. They don't have access to these services. They don't know how to get access to these services either. So what the intervention did was that working with them, it got them registered under ICDS to really help them get the chance to access the services which were made for them in the first place. And it was a intervention that raised at least 3 times the budget for nutrition, and Odisha joined the National Nutrition Mission, which it was not a part of earlier. The success of it was hailed by, of course, different ministers, especially the current Minister of Women and Child Development in India, and was scaled up to other states as well.
So I think what that Odisha example, just showed to us is that if people lead the change, it just works more easily because they feel empowered. आप खुद सोचो, you have lived in a system really for 20 years. एक तरीके से आप सोचते हो. Somebody from outside comes and tells you कि नहीं आपको ये बदलने की जरूरत है. लेकिन अगर change आपके अंदर से आएगा, you will lead societies, you will lead that, then it's absolutely different. So I think that's what Shireen was saying, and that has been one of the biggest learnings of my career. And I hope that PPF applies it, that, dictating to communities is not going to work. And I'm not saying that you are, but I'm just saying that if that's the strategy to work with communities, it won't work. It has to come from people themselves, and you need to be that body that supports them.
Being a part of them to bring that change. And I'm sure that's the takeaway of today's session with you.
Definitely.
Thank you so much. Just to summarize this, I think the scale of the problem as it is, it requires all of us the government, the local actors, and the community to come together and to act together. And all of us need to work in synergy to give back to the children, particularly their choices, particularly girls, their choices, their dreams, and their futures and their livelihoods and their childhoods. So with that, thank you so much once again, Dr. Chauhan. It was really nice to have you here today. And I would also like to thank your team, Ashita and Shireen, for their valuable views in between the session. So we look forward to a continued association, and we are going to prepare a brief summary of today's session, and we'll share it with you. We'll most probably also take it out in our next Prism, that is our monthly newsletter. So I'll share it with you for any feedback you'd want to give on that. And I'd like to thank you once again. Thank you very much.
Thank you, and keep working on that. And thank you to everybody who's attended and raised questions. It's not easy to change the world, but one step at a time.
Definitely.
All right.
Thank you so much. Thank you, Ashita.
Thank you.
Thank you, Monica.
Thank you.